Anti-emetic agents. So basically, these are drugs or agents that will prevent vomiting. So those are anti-emetic agents. So the general side effects of these medications include drowsiness or sedation depending on the drug. It can also cause confusion and hypotension. So first, let's talk about anticholinergic agents. So these are types of anti-emetic agents. So anti-emetic is their therapeutic class. Anticholinergic in this case is the pharmacologic class. So anticholinergic medications, the mechanism of action of this medication is blocking stimulation of the chemoreceptor trigger zone, and then it binds to the receptor in the inner ear. The therapeutic effects, this results to controlling or preventing nausea and motion sickness. So as you can see, therapeutic effects, it has to do with the indication. So when do you use it, right? In the presence of motion sickness and nausea. Some precautions are basically there because they are also side effects of this medication. So precautions include dryness of GI secretions, decrease smooth muscle spasms, which leads to reduction in nausea and vomiting. That being said, it can affect glaucoma. How? Well, it can exacerbate or worsen a closed-angle glaucoma by further relaxation and forward movement of the iris lens diaphragm, and then it basically blocks the drainage even more, causing a more increase in intraocular pressure. Again, precautions in the presence of glaucoma because it can make it worse. In addition, sedation and dry mouth. Again, this has a drying effect. So if somebody's already feeling dry, right, dehydrated, it can make it worse. And then sedation. If a patient is already somnolent, it can also make it worse. In addition, it causes urinary retention and constipation. So when you think about the precaution and side effects, think of it as dryness, loss of fluid. Some nursing actions in this medication class include assessment of therapeutic and side effects. And the drug that you have to remember is transdermal scalp or scopolamine. So scopolamine is a drug that you have to remember. Another pharm class under anti-emetic includes antihistamines. So the mechanism of action is mainly H1 or histamine 1 receptor blocker, and in addition, it does have similar mechanism of action such as the anticholinergic agents. Therapeutic effects as well as indications include vertigo. So this is the sensation of spinning or dizziness, and it normally derives from a problem in the inner ear. So vertigo, sometimes it also is related to problem with balancing. Next is nausea and vomiting. So it helps treat nausea and vomiting. So that would be a reason why we give this medication. Some precautions and side effects include sedation, dry mouth, urinary retention, and constipation. So as you may notice, it is very similar to that side effect of the anticholinergic. Nursing actions include assessing for therapeutic effects and side effects, and also patient education. So safety is a big deal when it comes to this drug class, as well as sedation, right? Because the side effect, it can alter the mentation of the patient, and therefore if you have somebody who's already very somnolent, they're at risk for falling, right? They're at risk for injury. So safety is a main concern when giving this medication. So it is also very important to educate our patient when you take this medication. Do not drive. Examples of drugs in this class include dimenhydrinate or Dramamine. Also under anti-emetic class are the dopamine antagonists. So the mechanism of action of dopamine antagonists is basically blocking dopamine receptor in the chemoreceptor trigger zone. So how does that help? Well, remember, dopamine helps regulate movement, right? So if we block that, it will help with vomiting. So it has also anticholinergic activity, so it aids to calm down the CNS. Therapeutic effect and indications, nausea and vomiting. Precautions and side effects. So remember, this affects dopamine, right? And so when you're talking about dopamine, it's inevitable to talk about seizures. So this medication side effect can include seizure and extrapyramidal symptoms, especially in children and elderly. So what are those? These are dystonic reactions. So these are characterized by involuntary contractions of muscles of the extremities, face, neck, abdomen, pelvis, or larynx. So basically involuntary movement of the muscles. And it can also cause tardive dyskinesia, which is a disorder that again results in involuntary repetitive body movements. So this can include grimacing, sticking out the tongue without really having any control over it. Other side effects or precautions are sedation, dry mouth, and hypotension. And we have to remember that we have to be very careful when administering promethazine via IV route. So the preferred parenteral route of administration of this drug is actually deep intramuscular injection. That being said, this medication is sometimes administered intravenously, but we have to be very careful. Under no circumstances should we ever administer this medication intraarterially. So we have to be careful. We have to make sure we're not administering it in the arteries. Also, when we're using the medication or administering the medication intravenously, we have to make sure that the concentration is actually appropriate, because it can actually cause severe vascular complication and can cause tissue death or tissue damage in the area of injection. Some nursing actions include assessing for therapeutic effects and side effects, and definitely because of the side effects, right, and because of the mechanism of action of these drugs, we need to assess our neurofunction, right, and also safety assessment is very important. The drug examples that we need to remember are prochlorperazine and promethazine. The most common one that we see clinically is actually promethazine. Serotonin antagonist. Let's recall what serotonin does. So serotonin affects emotion, also motor skills, and it can stimulate nausea. So the mechanism of action of this drug, right? So this is a serotonin antagonist. So it's a blocker. It blocks 5-HT3 receptor in the GI tract and chemoreceptor trigger zone. Therefore, the therapeutic effect or indication include prophylaxis, so means prevention of chemotherapy-related nausea and vomiting, as well as prophylaxis and treatment of nausea or vomiting in virtually all kinds of settings and all kinds of reasons. Precautions and side effects. So we have to be very careful because these are possible side effects, right? Headache, dizziness, and diarrhea. Nursing actions include assessment of therapeutic effects and side effects. Also in practice as well as patient education, we need to ensure that ondansetron orally disintegrating tablet. So this specific formulation of this drug, it's an orally disintegrating tablet. Right? We need to make sure we read the packaging. We need to make sure, especially if we're going to send a patient home with this medication, to let them know that this medication shouldn't be swallowed, right? And usually this should just stay in the mouth, sometimes under the tongue, and this on its own will start to melt. So the patient needs to allow this tablet to melt. They shouldn't swallow the tablet. Drug example that we have to remember for this course, and this is also the most commonly seen and used drug from this class in the clinical setting, is Zofran or ondansetron. Ondansetron or Zofran can be administered as a tablet as well as intravenously.